Today we're going to administer intradermal lignocaine to a patient prior to IV cannulation. The reason we're doing this is to reduce the amount of pain from the cannulation. So we're going to get the patient's consent and also check that they're not allergic to lignocaine, which is the drug we're going to use, or to any other anaesthetics. So they've told us they're not. First of all, we're going to select our vein that we're going to use, and we're going to prepare the site for the intradermal injection around it. We're going to use a alcohol swab, aseptic circular technique, and we'll let that dry while we draw up our drug. And we have 1% lignocaine, which I've checked and my partner has also checked, and the expiry date on it is March 20. So I draw that with a 5mm syringe and a drawing up needle. Sharps out. And the adult dose is 0.5 to 1.5 mils lignocaine. So we will administer a dose of 1.5 mils. So we're going to get that in our syringe. Drawing up needle to the sharps container. And we're going to use a small gauge needle. For this, in an ambulance setting, you'd probably use a 25 gauge. In this setting, we have a 27 gauge, so sharps out. So, finding our location, we're going to go in on a shallow angle. This is an intradermal injection. So, next to the vein, a little bit of tension. Tell there's a sharp scratch. Just going to draw back on the needle, make sure that there's no blood there. So there's no blood, so I'm happy to depress the plunger. I'm going to do this slowly because it's going to be painful. I'm also going to be looking for a bleb, which won't be evident on this arm. Right, so pop down to the sharps container. Going to leave that 1 minute to act before I cannulate. I'm also going to observe the region for any allergic reactions. I'll be documenting that on my paperwork with the drug dose, the time, and how it was given, so intradermally.